Hi everybody, Dr. Adam Smith, Ultimate Bariatrics. Going to talk about post-op care. Every person's post-op journey is different. We're all unique human beings. We have standardized protocols that we follow on an uncomplicated post-op course, but just because you don't follow what everyone else does doesn't mean something bad has happened to you. A typical post-op metabolic or bariatric surgery patient will have their surgery. They will either go home the same day or the next day. On some occasions, like especially revisions and things like that, they may stay 2 or 3 days. We determine which facility you go to is determined A, by insurance contracting, B, by complexity of the surgery, C, what level of acuity post-operatively you need. Do you need to be in the ICU overnight, or can you go home the same day? All of those things factor in onto how we take care of you post-operatively. As a general rule, we see you the first week post-op for a wound check. We strongly like that to be in person, but if you're coming from way out of town and you're doing absolutely 100% perfect, we will do a televisit at your request. Then the dietitian stays in play with you. She does your pre-op teaching so you can survive that first week, and then she checks on you week 2 to see if you're ready to progress your diet. A typical post-op course, you're on a clear liquid diet for about 5 to 7 days. Then you're on a full liquid diet, which is kind of like baby food consistency stuff, for about 5 to 7 days. And then in week 3, we start doing what we call chewables and mashables. That is, if everything goes the way it's planned. There are always exceptions to that. How do I know if I'm having a problem post-operatively? This is very important, and we give you this to you in writing, we tell it to you pre-op, but you just need to remember. Number 1, fever. What is a fever? We consider anything over 101.5 degrees of fever. We don't really necessarily consider 99 degrees of fever, but if you're symptomatic with 99 degrees, we need to know about it. The second thing is pain out of proportion to what you are expecting, okay? You're gonna have pain post-op. We're making incisions, we're operating on you. And we score pain 0 to 10, and we cannot get you to a 0 post-operatively without putting you in a coma. So we want your pain to be a 4 or below post-operatively. So we still employ a variety of pain medications, and of course, if you're having a bypass or bariatric surgery, we don't want you taking Motrin or Advil or Naproxen or any of those anti-inflammatory medications post-operatively, because they can impair wound healing of your anastomosis and can cause an ulcer. So we use plain old-fashioned pain medicine, and we love Tylenol, if it's appropriate. So fever, chills, weakness, pain out of proportion to what's expected, intractable nausea and vomiting. Dehydration is our enemy. If you're not getting an adequate amount of water in, we need to know. Don't wait. The earlier we can intervene, the better you're going to recover. We have the ability to start IVs in the office if we need to, or even if we have to keep you an extra day or 2 in the hospital, no big deal. We don't want you to get behind, because that first week is really important for you to have a good week. So that's kind of things to look for post-op is fever, chills, weakness, pain, nausea, vomiting, dehydration, not walking, any of those things we need to know. Don't wait. There's a doctor in the office 5 days a week. There will be a doctor available to see you. It might not be your surgeon. It might be me. If Dr. Roberts did your surgery, I might be the guy in the office that can see you, or vice versa. But we have a PA, we have a nurse practitioner, we have doctors. We're there for you. Don't wait. If you think you're having a problem, let us know as soon as possible. And that's post-op.